Aloha gang, Dr. Russ Rosen here, and welcome to the OHC System Facebook Community Masterclass. I'm Dr. Russ Rosen. Did I say that already? And I help people like you, natural healthcare providers, thrive in a care versus care true optimal health model so that patients happily stay, pay, and refer for a lifetime. We're here 3 Tuesdays a month at 1:30 California time, right here, just like this. We'll be off 2 weeks coming up here, and then back on November 5th. If you're finding value in the call today, please know that you can jump into the community. If you're interested, you can jump into the club. If you're interested in that, let me know, and I'll give you free access for a month, where we dive quite a bit deeper into certain pieces which you'll know more about. I will say aloha and let me know if you are there. And in case you're there, you can go ahead and say howdy. And obviously, if you're watching this on a replay, you have any questions, just comment below, and I will get back with you and answer any questions I have. Okay, so today we're diving into daily interactions. You and I, look, we've been talking about this. I know you want to help your patients, practice members, clients, whatever you want to call them, get healthy, stay healthy, and have the best life possible. And you want them to stay, pay, and refer for a lifetime. You want them to stick around long enough to get the results they need to get. But we get so frustrated when our patients don't follow through with care. And so we know if they stick around long enough, they're going to get better results. But if they don't stick around long enough, they're not going to get the kind of results. And I oftentimes say, tongue in cheek, that any moron can get people to sign up for care, but it takes a wise person to get them to stick around. And daily interactions is where the rubber meets the road. So you've done a great consult and exam, you've done a great report of findings, they sign up for care, and then the challenge is either they feel better or they don't and they leave. The average retention for chiropractors is about 20 visits. So you take your patient visits over a 3 or 6 month period of time, divided by the number of new patients, and you get a number. Average is about 20 for chiropractors. It just depends, naturopaths, osteopaths, et cetera, what kind of work you're doing. If you're doing more hands-on, then it's very similar to chiropractors. If you're doing more functional medicine, then it's different. But regardless, if we're not doing this part right, and is there a right way to do it? Yeah, I think so. And we're going to talk about that right now. Then if we're not doing it right, what happens is we get old spouse syndrome, where they are coming in, it's a regular visit, it's wham bam, thank you, ma'am. The patients, don't feel like we really know them or what's going on with them. And again, they either feel better or they don't. So they're either running from the barking dog, the pain, or the pain goes away, so they stop care. So if we want them to stay long enough, and in the report of findings, we talked about this. We talked about how much care it really would take somebody if they said, I have all the money in the world, I trust you implicitly, I want to get as healthy as I possibly can. And remember, you can get this in the club if you like. Then it would probably be quite a bit of care, and it would probably cost quite a bit of money for them to get those kinds of results. So our visit to visit, regular daily visits, there are very specific things that need to happen. So as always, I went to my best friend, ChatGPT, and I asked, and in this particular case, I didn't say as a natural health care provider. I specifically said as a chiropractor. Now you can translate this for how you practice, but it's going to be really similar. So I said, as a chiropractor, what needs to happen on regular visits with my patients so they're happy and they stick around through their entire care plan? And this is the response. And again, I'm always amazed at the responses because it's stuff that I'm agreeing with, saying, yep, that's what we do. But it's not my experience when I see other medical doctors, chiropractors, naturopaths, acupuncturists, etc. So to keep your patients happy and committed throughout the entire care plan as a chiropractor, it's important to focus on both the clinical aspects and The patient experience, headspace, procedure. Here's a breakdown of what should happen on regular visits to foster long-term satisfaction. Build trust, rapport. So warm personal welcome, genuine listening, explaining the process. Yep, I agree with that. We've talked about how important rapport is, etc. Regular assessment and feedback. So we're going to reassess their progress regularly. So regularly measure their progress through objective tests, range of motion, pain scale, posture assessments, etc. is what they say, and then show them that they're improving. Clear communication on milestones. Break down their care plans into milestones, celebrate when they hit these, even small ones, and show them each visit, show how each visit contributes to their long-term goals. This is right out of the book Change or Die. I can't recommend enough you read the book Change or Die. They talk about what doesn't work is fear, facts, and force. Aloha, Jan. Aloha, Ian. Good to have you guys here. So fear, facts, and force don't work. But there are three things we need to do. We need to build a relationship with them so they trust us. And they need to understand, the one I want to talk about right here is that on each and every visit with us, they must see change, even if they're going backwards. If they're going forwards, they need to see that they're going forward and why. If they're going backward, that's okay, as long as they understand why. Okay, and we're going to show you exactly how to do that. Set expectations. Yep, we're going to be talking about that this time and last time. We'll be getting right into that in a minute. Provide tailored adjustments. So look, we're so used to the downside in chiropractic of wham bam, thank you, man, doing the flying seven. You've heard patients come to you saying, yes, I used to see what's her name down the street. Why don't you see her anymore? Well, because I don't even think she knew my name. Like I would go in there and she'd roll me left, roll me right. Can you do high volume if you're a high volume chiropractor or any kind of practitioner and still have it feel very customized, still have them feel heard, still have them recognize that you really know who they are and what's going on? Yes, as long as you have 30 seconds to a minute per person, I can show you exactly how to do it, which we'll be going over right now. And obviously, if you have more time, then even easier. And then educate and empower. So educate and empower, explain the bigger picture. Yeah, obviously continue to educate patients on the benefits of care, not just for pain relief, but listen to this, listen to what ChatGPT says, but for overall health and wellness. Can you believe that? But that's not what we usually do. Okay? Home exercises, lifestyle advice, address questions, etc. Consistency in experience. Listen to this one, punctuality, be on time. Running late is roundup to the root system of referrals. So running on time, really important piece of the puzzle. Creating a comfortable environment. It's not like going to their dentist once a year or twice a year. They're coming to see you 3 times a week for an extended period of time. Make it easy, make it smooth logistics, easy to get in, easy to get out, right? Good parking, the whole experience, okay? Reinforce the value of continued care. Educate on maintenance. Yeah, okay, so every step of the way, we're building value for the next step. We're building value for the reeval report. And then at the report, we come up with a new set, a new plan, and then we're building value to the next reeval report. Always reevaluating what their health goals are, where they're at, and where they may want to get to. Let me see, it says check-in post-discharge. Even after the care plan ends, consider reaching out, follow-up calls and emails to maintain a relationship and encourage future checkups. Yeah, absolutely. Show appreciation, gratitude, thank them for their commitment and trust, recognize their effort in attending sessions and doing any exercises or lifestyle changes. This is a really important piece of the puzzle. And then referral programs and promotions. Okay. So then it says, and again, like I can't believe this is what it says, but it's not what I see. It's not what most people do. It is what I'm going to be teaching you right now. By making each patient feel seen, heard, and valued while delivering effective care, you'll create a positive and trusting relationship that keeps them committed through their entire care plan. Ruth, welcome aboard, Dr. Ruth. Okay, so let's dive into daily interactions. In my world, and I'm going to be saying this as if you were a chiropractor, but you can translate it however you practice. I talk about adjust their spine and mind every visit, right? We're always talking headspace and procedures. So I want to make sure that we're not just taking care of the physical body, but we're stretching their consciousness over time. We're bringing them one step closer to your vision of vibrant and optimal health that you hold for them. Your vision of what they can get is much higher than what they thought when they came to see you. Right? So we're always one step ahead, bringing them one step ahead. I call it in 1 to in 8 over a lifetime. For those of you who are not chiropractors, in our philosophy, we talk about innate intelligence. It's that life force that comes through egg and a sperm. Here you are, innate intelligence knows how to run the show, right? So we're not going to start with, in this office, all we do is, right? We're going to meet them right where they're at. And every step of the way, we're going to bring them one step closer to that massive vision that you have. Christy, you actually made it. Ha! Adjust their spine and their mind. Yes. Christy is a nurse, and she's an amazing, amazing practitioner who works with her dad, who is a chiropractor. And she takes care of what most of us would call kind of the functional medicine aspect. And she's heading off to osteopathic school. So good on you. All right. So in 1 to 8 over a lifetime, we're going to help them take more responsibility for their health. Every step of the way, we're looking at getting them to make the appropriate lifestyle changes that they need to make. And again, 30 seconds to a minute. It's all you need. We'll be showing you in a second. And then I would like them to have more appreciation for my expertise. Would you like your patients to have more appreciation for your expertise? If so, pay attention, because what we're doing will cause that to happen. All right. Now, what did I write there? Yeah, I don't need that. All right. We've been talking about this, kind of two different metaphors. One is the visit consultation was chapter 1 in the book. The examination, chapter 2 in the book. 12 visits, chapter 3, reevaluate, re-report, chapter 4. We also talked about walking them up a series of steps, right? Going to the first floor, to the second floor, consult, to the third floor, exam. I want to keep the same thread of the story going. So often what we do is we talk about get healthy, stay healthy, have the best life possible. And on our first visit, when we adjust them, we check in, or we do whatever we do with them. We check in and we go, how's your neck today? Oh, that's doing better. Great. Then you're coming along. And we lost this whole vision of get healthy, stay healthy. Okay? So don't kid yourself that just because they signed up for a care plan, it means that they're going to stick around for the entire care plan. Also, don't kid yourself that because they signed up for a smaller care plan, they're not going to stick around for the rest of their lives. Different behavioral styles, different moments in their life. So regardless of what they signed up for, I need to keep meeting them where they're at and bringing them to the next level. It takes continuous work. We all have trophy cases full of patient files, or if you're all digital now, they're trophy digital cases of people that have come to see us that don't see us anymore. Okay, so there are 4 steps that we're going to go through on every patient visit. On an average, it takes 30 seconds to a minute. You're going to see that it can take a little bit longer once or twice, but in general, that's about what it takes. Now, before I jump into the 4 steps, the question is, from a reptilian brain's perspective, I want you to keep that in mind. What are we trying to do? We're trying to talk about them, ask Socratic questions, use stories and metaphors to draw their story out of them, draw their story out of them, apply our story to their story, and teach them so it goes past the reptilian brain to the neocortex for thinking, reasoning, and problem solving. It drops in the limbic system as a new belief system, 8-ball, quarter pocket off of the side. Okay, that's what we're going to be doing. So the 4 steps, and you can write this down, the 4 steps are: 1, anything new or different. We're going to be checking in, is there anything new or different? Number 2, last time. Number 2, last time. Number 3, this time. Okay, so 1, anything new or different. 2, last time. 3, this time. 3A. 3A, why do you think that is? Why do you think that is? Question mark. 3B, where do you think you are? I think I'm on planet Earth. 3C, build value for the reevaluation. So 3C is build value for the reevaluation, and 4 is give a coaching tip on the way out. So I'm going to check in, is there anything new or different? I'm going to start working, and I'm going to say, last time I noticed, this time I noticed, either why do you think that is, where do you think you are, or build value for the reeval report. And I'm going to give you a coaching tip on the way out that most likely will be in relationship to what we were just talking about. I know that there are programs out there on visit 1, teach them this, and on visit 2, teach them that. And those can be really good when you've run out of things to talk about with them. But my experience is if you're really meeting them where they're at and you're doing this time, last time, this time, you're not really running out of things to talk about. And I'd much rather be teaching them through their story. There's always something I can teach them, right? I know all the things that I'm going to be working with to teach you. I can always apply it to your story. So I would much rather do that than one of those kinds of programs. Okay, so step 1, is there anything new or different? Now, you're going to need to let them know right before, if you adjust them at the report of findings, at the end, or whatever the first adjustment is, you're going to let them know that before each visit, I'm going to be asking you, is there anything new or different? And you need to train your patients to know that that's what's coming. So in my world, I want to train them to be in the position that I want them to be in. Do you want them seated? Do you want them prone? Do you want them supine? I don't want to waste a lot of time. So I'm going to come in, let's just say they're prone. I'm going to, if I come in on this end where the feet are, I might grab the feet. I might grab a calf just to anchor. Hi, I'm here. So, hey, good to see you. Anything new or different? I'm going to let them know if there's something new or different. 30 years of headaches are gone. I need to know about it. Got hit by a truck. I need to know about it. Other than that, let's get down to business. And I'm going to let them know, and I happen to like this term, you use whatever you like, is, so I'm going to be asking if there's anything new or different. If there is, you're going to let me know. Otherwise, you're just still in process. You'll let me know, and we'll just get to it. I'm not going to waste your entire day here. Okay, so quite a bit to that, but that's a hint of some places you can go with that. Okay. Yeah, okay, I don't have time to go into that. All right, so here we go. When they come in, just know that there are really 2 categories. One is, I'm okay. So yeah, all is well, I feel great. All is well the first time, I feel great. I still have this stuff going on, but all is well. I know I'm in process. I have some new symptoms, but I'm not in crisis. I'm not worried, I'm not concerned. And then there is, and I'm not okay. I'm not okay. Like, this is not getting better. I'm not happy. I have some new symptoms. I'm not happy. I'm in crisis. I don't think this is working. I'm not happy. I'm going to quit, right? If they're not okay, you got to sit them up and look in their eyes and have a conversation with them. Okay? If they are okay, I'm going to let them know up front, we're not going to do a laundry list every time you come in. How's your pinky? How's that little bit of skin stuff in your stinky armpit? And I'm not going to do that. I'm just going to check in. Is there anything new or different? If so, you'll let me know. And if not, we'll get right down to business. Okay. So that's enough on anything new or different. Now, last time. This is where so many of us blow it, because we just walk in and we go, how's your neck today? Great. Okay, well, let me check your neck. Right? We've lost the whole story of get healthy and stay healthy. We've lost the whole story of the nervous system. And again, if you're doing functional medicine or Christy and you and I have talked a lot about, it's exactly the same for how she practices, doing, cellular detox and functional medicine, etc. It's last time this is what was going on. This time this is what we're seeing going on, right? So if you're doing hands-on, you're going to palpate. Start palpating the low back, start palpating the neck, wherever it is you start off. Or if you're doing, more discussion, maybe functional medicine or maybe, counseling kind of work that you're doing, talk therapy, any of that kind of stuff, you're touching on that subject. You're still doing touch, tell, ask, and teach. Okay. So you're going to remind them of what happened last time. Last time your pelvis was really locked up. This time it's really starting to move. Can you feel that? Or last time your pelvis was moving really well. This time it's really locked up. What do you think that is? Okay. I always want to start with last time because I want them to know that I know who they are and what was going on with them. Now, to do this, I have doctors say, well, then I would have to take notes. Yes, you would have to take notes. You'd have to be a professional. You'd have to know what's going on with your patient. I'd agree, right? Do you need to take copious pages? Not at all. Not at all. But at least you need to know what you were doing and what was going on with them. I think we owe that to them. I've had doctors disagree with me on that. It is what it is. Okay, so in the book Change or Die, they talk about each time the patient needs to see that something changed and it's moving in the right direction, and that makes sense, or it's moving in the wrong direction, and that makes sense. Either one is okay. In my world, I want 2 before and afters. Last time, this is what was going on. Wow, this time, this is what's going on. Give an adjustment, or do whatever, do your needles, do whatever you do. Now I can see another before and after, right? So last time we saw this, now we see this, right? So we're seeing this, do the work, now do you see this? And they need to understand that. They need to understand what's happening. Okay, so that's the last time piece. This time I need to compare and contrast what it is that I'm finding. Right? So last time it was locked up. This time it's really moving well, right? So that's where this touch, tell, ask, teach comes into play. So last time the low back was really locked up, and this time it's starting to move. Can you feel that? Yes. Now this area, if you'll remember, goes to what? And I'm going to take my hand, go right down the butt, down the leg. Yeah, it's that pain down my leg. How is that pain down the leg? Touch, tell, ask, teach. Oh, wow, that's actually starting to feel better. Far out, why do you think that is? Or, so last time we noticed that this was locked up, and now it's really starting to be feeling better in here. Now this area also went to what? Do you remember? Go around the belly. Yeah, my constipation. How's that been? I've been pooping like a racehorse. Far out, why do you think that is? Right, I've talked about this in my modules. I had a gal that I was doing work with, and she was a friend of mine, and her husband was a longtime friend of mine, and they were trying to get pregnant, could not get pregnant. Tried everything, did in vitro, nothing worked. And so it had probably been maybe 6 months to a year that they kind of gave up on having a family. And I saw her pelvis go from left short leg, which was kind of rare, to right short leg. Like her whole pelvis shifted. This whole thing shifted. And she came back in, and it was a very different pattern. And I told her, I said, so remember this area, and she had a lot of PMS also. So I said, this area also goes to what? And by the way, she was there for neck pain and headaches on a work comp injury. Okay. But, it's all connected. So I checked and I said, wow, pelvis really shifted. And this goes to what you remember. She said, yeah, PMS. And I said, right. Now, she hadn't had a period, so we hadn't noted that changed, right? But I did say, so this goes to these organs, right? And so I know that you and Eric were looking to have kids. If you're now not looking to have kids, just be aware that these nerves go to those organs, and that may actually change. Okay, 6 weeks later, she walks in an open room, joyfully screams, Dr. Rosen, you got me pregnant. Didn't go over so well, but she got it, because that stuff happens all the time. It happens all the time that people are getting better of digestive and sugar handling and all kinds of wonderful things, getting pregnant that couldn't get pregnant. They just didn't know it had anything to do with you. But if you're using your touch style as teach, you're saying last time we saw this, this time we see this, and you're helping connect the dots for them, they're going to start to see that these things do improve, and you get the bonus points for it. Okay? I got a laugh there. Good. Thanks. I appreciate that. Okay, so last time, this time. Now, we're going to be, my question that I want you to think about is this. Why am I asking them, what do you think that is? So I just said this area could be related to the, down, what does that go to? And they go, right, it goes down my leg. Now, how do I know that they know that? Because we did it in the exam. We did it in the whole story. They came back to the reported findings. We did it in the whole story again. Like, they're getting this. So when I say this area goes to what? Yeah, it goes down my leg. And how is that doing? It's doing better. Far out, what do you think that is? Because otherwise, they think it's Mercury in retrograde or Pluto's in Uranus, right? They don't think it has anything to do with the work that you're doing. But if there's going to be value, they need to see that it is related to work that you're doing. Okay? So I want to be curious. I'm curious. Do you understand why that is? Right? Again, we've said the whole story out loud. They've done it in the reported findings. We're asking Socratic questions. They should be getting it. Now, what we're now going to do is we're either going to commiserate and educate, or we're going to celebrate and educate. If they're not doing well, have the appropriate tone, commiserate with them, and educate. If they're happy and they're doing better, celebrate and educate. So let's dive into a few of these. I'm feeling better. Far out. I'm so happy you're feeling better. Now listen, you promised that you were going to continue care. Now it's not the time to stop care. That's what a lot of us have been taught to do. It just rains on their parade, right? Let's not do that. I'm feeling so much better. Far out. I'm so happy to hear that. Why do you think that is? Now, what I want to hear is this as an answer. And I'm going to say it as if I was a chiropractor, but you would do it for what you do. Well, you've been adjusting me, correcting my subluxations, and I'm starting to get proper nerve supply. I have not been aggravating the subluxations. I've been eating better, exercising, and dealing with stress. And therefore, I am beginning to heal myself, and I'm beginning to feel better. Now, my question to you is this. Would you be happy with that answer? And if the answer to you is yes, you'd be happy with that answer. The question is, do you think that that's what your present patients would say if they were feeling better and you said, why do you think that is? If the answer to that is no, do these processes and they will. Now, I can promise you that at least 50% more of the time when you ask the first time, they're not going to know how to articulate it. They'll understand it, but they can't articulate it. That discussion takes us about 10 or 15 minutes. I will be doing that in the club on Thursday. If you want to join, just go ahead and put club and I'll get you a free month in there and you can come on Thursday. But we'll be going into great detail of the exact series of questions you have to ask these people so that they can get that once and for all and say it for the rest of their lives. Okay? And I promise you this. The doctors that I've coached on Maui, I was 20 years out of practice, and they would have patients coming in fully understanding touch, tell, ask, teach, whole story, all this stuff, because I walked them through this process. Okay? All right. The other flip side of that is this. I feel worse. Commiserate. I'm so sorry to hear that. What question am I going to ask? Well, why do you think that is? I'm curious. Why is that? Now, the answer I would like to hear is this. Well, I understand that the three things that can aggravate subluxations and my boobitis is mental emotional stress, biochemical stress, and physical stress. Here is what I did that aggravated that. Again, if you want to know how to do that, Thursday I'm going to go into great detail of the questions you need to ask so that they get that they own that they really understand that. Okay, there's a bunch to it. All right, now let's jump into a couple of other pieces right here. And this is such a critical piece of the puzzle. For most all of us, we haven't used this in the past. Again, if you want to get a copy of this, you can get one in the club. So jump in there, you can grab one. But here's the deal. The first time someone says, I feel great, this is where we blow it. We either, assertives, aggressive, all right, glad you're feeling great, but remember, you're not there yet, and you promised, blah, blah, blah. Or we say, far out, I'm so glad you're feeling better. Isn't that wonderful? And there was no teaching experience. Remember, draw their story out of them, take your story and apply it to their story. So that's what I want to do here. So first time they're feeling really, really good, odds are I've already asked, what do you think it is? And they already get it. So 2-3 times in a row, and they're saying that out loud, they fully understand it. Okay. Now, I say, far out, where do you think you're at? And they say, I think I'm a plus 10. How do I handle that? Okay, really important piece of the puzzle. Well, I'm so glad we're having this conversation. I'm so glad that you're feeling so good. You remember at the beginning, we said it would probably take about a year to get up towards a plus 10, but probably in the first month, you'd be feeling better. Yeah, I remember that. How many visits have we done? 9. How many weeks are we into it? 3. So if we redid all your tests, do you think we will fully resolve all the objective tests? No. So where do you think you're at? Oh, right, I'm probably around a 0. Great. Or they say, I think I'm probably around a 0. And I'm going to say, great, I'd agree with you. The next question I must ask is what? Anyone? Okay, it's, do you still want to get to a plus 10? Now, I have doctors tell me all the time, why would I open that can of worms? They already signed up for your plan. And the reason is because they are reevaluating it right now. And if you don't, again, teach them, right, stories and metaphors, if you don't teach them, they may be reevaluating and not coming back. So I'm going to say, so glad you're feeling great. You recognize you're probably around here. Do you still want to get there? Yes, I do. Now, there's one more question we have to ask. Can you think of it? One more question. All right. So the number one reason why men or women don't come back, or men or parents with their children, they're not bringing their children back after they just said to you, I'm so happy with Kara. I love you. You walk on water. You're rocking my world. I definitely still want to get towards optimal health. Thank you so much. The number one reason they don't come back is their spouse or best friend. Their spouse or best friend says to them, why are you still going to see Dr. Rosen? You feel great. Okay, so I'm going to handle that. I'm going to handle that right now. I'm just going to say, great, so you still want to get to here. That's fantastic. We got a reevaluation coming up in a couple of visits. We'll get to see where you're really at. So glad. But let me ask you a question. When you go home and your sweetheart or your best friend says to you, why are you still seeing Dr. Rosen? You feel great. What are you going to tell them? It's a record scratch. I need them to be able to say, because I'm sick and tired of being sick and tired. I want to get healthy and stay healthy. I want to resolve my problems. If they can't say that out loud, I'm going to help them say that out loud. So when they do go home and that happens, I'm not going to lose those people. Again, I'm not going to lecture them. I'm going to apply my story to their story. Okay. Now, the last piece of it, anything new or different, last time, this time, so what do you think that is? Where do you think you are? And now it's build value for the reevaluation. Now in our outcome assessment questionnaire, these questions right here are about their symptoms. These are about their function, right? My posture, my range of motion, my ease of being in my body, amount of anger, hate, jealousy, envy, joy, happiness, bliss, right? What are their experiences? And then these questions are all about their life. They're all about their lifestyle and their life, what they're experiencing in their life. So I'm going to start to look through some of these questions, and I'm going to start to pre-frame those questions for them. We're going to be building value for the reeval report. Oftentimes we'll see people will not come back on visit 11. They stop coming in. Why? Because they don't see the value of the re-report, or they think you're going to try and resell them and pressure them to continue. If we're doing it this way, that's not going to happen. So I'm going to be checking in and I'm going to be saying, so I'm really looking forward, Ruthie, to the reevaluation that's coming up. So originally, Ruth, you thought you were a -4 and you wanted to get to a +10. Where do you think you're at now? Now, again, if she thinks she's a 9 and I think she's a 2, and we get to the we get to the re-report, and she thinks she's done, that's a tough road to hoe because she thinks she's done. So I'd like to handle that ahead of time. So you thought you were here, you'd like to get to there. Where do you think you were at now? Where do you want to get to? Do you still want to get to that level of health? Do you feel that you've reached your present health goal? If you could continue to get healthier, what would be another or newer health goal? How often do you think you need to be coming in? I think you're getting close to going down from 3 times a week to 2 times a week, right? Because you're coming in with little to nothing to do. Any of those kinds of questions are things we can do. I'm excited to check the range of motion. I'm excited to check your SRE. I'm excited to check your heart rate variability, your x-rays, your spit, pee, and poop test, your blood work. Like whatever it is, I'm really excited to be able to take a look at those. If I build value, they'll show back up. Okay? And then we're not on for 2 weeks and we're back on and we'll be going through the re-eval re-report at that time. So you just starting to throw these concepts out and building value. Again, I don't want to show up and get blindsided with them thinking they're done. And again, I hear this all the time. How could they possibly think they're done? You see it all the time, right? You sign people up for an entire year of care, and on month 3, they come in and they thought they were done. They've paid for it. They're scheduled out for an entire year, but they thought they were done. How? It's just how the brain works. It's how we work. Right? So I'm going to just keep handling these things ahead of time so they don't become problems. Okay. And then the last thing that we're going to do is we're going to give a coaching tip on the way out. There is a ton as far as coaching tips goes. Mostly it's going to be in relationship to what you guys were just talking about. It might be a lifestyle, eat better, exercise, deal with stress, do these particular stretches, like whatever it is. Obviously, if it is someone who's been under care for a long time and they're doing really great, then there's not a whole lot that we need to talk about. But I don't want old spouse syndrome to kick in. So I'm still doing last time, this time. God, you're doing great. Again, hardly anything to do. You know, stay the course. It's easy. There's not a lot we have to do. But in the first 30, 60, 90 days until they're, really doing well like that, there's a whole lot that we need to talk about and give them little coaching tips, little things that they need to do. Now, most of us were taught how to speak with patients from here, -10 to 0. I've met very few practitioners that know how to speak to people from 0 to +10. A hint, and again, I have a whole section in our modules on this, but a hint is that this is usually running away from, and this is usually moving towards. Okay, this is less. I want less aches, less pains, less problems, and this is more. I want more joy, more happiness, more flexibility, more passion, like those kinds of things. Okay, and again, if you're going to have a retention at a minimum of 60, I personally would like to see it over 100, then you got to learn to speak in a whole different way. Okay, so again, I know that's a lot of information. I get that. But I keep trying to cut these down to like 10 or 15 minutes, and I want to give you more information. So I hope that you found that of value. If you would like to get into the club, we are going to be diving into way more detail on the sections of how to get them to say those things and really understand them. Just put club below. We're going to be out for 2 weeks, and then we'll be back on November 5th. We'll be going to the re-eval re-report, and hope that helps a bunch. If you do find value, please let me know you're out there and that you did. If you found anything of value out of it, Sigrid, welcome aboard. Christy made it. Yep. Ruth. Yep. Ian. Jen. Yep. Good. So thank you all for being here. I appreciate it. As always, much love and aloha. Bye, gang.